Well, for the third straight week, local and state health officials shared some good news about COVID-19. They believe the virus is not spreading as much in Washington.
Though testing is decreasing here in Spokane County, the health district doesn't think it's impacting health data as much as you think. Mayor, so what are the numbers showing?
Well, they're showing this wonderfully flattened curve, and that's been the goal since March. You could see there were a few days here last month where we had more than 100 cases reported on different days. Now there have been just 115 total in the last 3 days. That's why there is some encouraging news, even as testing has decreased in Spokane.
For months now, health experts in the U.S. have said widely available testing is the key to ending this pandemic. But here in Spokane County, testing is actually decreasing.
The testing volume does seem to be down, and there's no really good explanation for why.
That isn't stopping Spokane's top health officer from feeling optimistic about the county's latest health trends. And that's because the positivity rate of tests that are being done. Dr. Lutz says about 8.5% of tests done in the last 2 weeks have come back positive, a critical drop-off from the double-digit percentages seen earlier this month.
Those things support that there might indeed be less disease in the community.
COVID-related hospital visits are also on the decline, proving the severity of this virus to be trending in the right direction. Right now, 50 people are hospitalized from the virus in Spokane, 40 of which are residents.
Kootenai is still a bit of an outlier. They're still having a number of hospitalizations over there, but yeah, our hospitalization rate is definitely going down as well.
Tonight, the CDC also changing its guidance for COVID-19 testing, saying people who have been exposed to the virus but are not symptomatic no longer need to get tested. That's a full reversal of the guidance issued from the CDC over the last few months. But in the end, it's only a recommendation, and several states, including Washington, say they will not follow it. They say testing asymptomatic people prevents them from spreading the virus unknowingly.
If you've been exposed to someone with COVID, you need to quarantine for 14 days. If you develop symptoms, you need to seek out testing for that.
Now, California Governor Gavin Newsom also just said that state won't be following the guidance. That's important because about 40% of people who catch COVID-19 may not even feel sick. Nia?